The question is, how do you know that you have carpal tunnel syndrome? There are diagnostic tests that provide objective evidence for carpal tunnel syndrome and can help to rule out medical conditions that can mimic it. So it's important to first get an accurate diagnosis. Some of the mimics of carpal tunnel syndrome would be a cervical radiculopathy, meaning a pinched nerve in the neck. And that can cause numbness and pain and weakness of the hand, just like carpal tunnel syndrome. So it's important always to get that accurate diagnosis, because you can't jump to treatment until you know what the diagnosis is. And physician can identify exactly where the problem lies. One of the testing that helps to identify carpal tunnel syndrome is nerve conduction studies and electromyography. This is a computer generated test that can identify slowing of the nerve across the carpal tunnel, or can actually identify that the problem lies more proximally within the nerve root, or even proximal to the median nerve, so in the forearm or arm. And it can also identify whether you've got two problems. You may have carpal tunnel syndrome and cervical radiculopathy, and that occurs in up to 30% of patients with carpal tunnel syndrome. And it's called a double crush syndrome. It's real important to identify exactly where the problem is and how severe it is, because carpal tunnel syndrome can be treated. It's most treatable in the early stages. There is a point at which there is irreversible damage. If you have constant numbness of the hand, if you're developing weakness of the hand, it's very important that you get the diagnosis so you avoid irreversible nerve damage.